Welcome everyone, and thanks for your participation in today's webinar. My name is Eva Moreno Anadon. I am the country director in Alianza por la Solidaridad in Palestine, and I will be moderating this session. We would like to inform you that the session will be recorded and uploaded on social media later on. I will kindly ask you to mute your micros when you are not speaking so that the sound is more clear for everyone. This is the second one in a series of webinars organized by Alianza and the Institute for the Studies on Conflicts and Humanitarian Action with the support of the EU Aid Volunteers Program. Today, we are going to discuss about the emerging protection challenges that will, with the pandemic, came up and the importance of feminist leadership in coping with them. We have today three wonderful women that I'm going to introduce now. We would like to keep the format of the session as dynamic and interactive as possible. So I will be throwing some questions to the participants. They will be responding, and we will be checking the chat to see if there is any specific question or comments or additions by the participants to add. In this case, we will open the floor for the public, for the participants to pose this question or to participate in the debate. So let me start by introducing Elisa. Elisa Paz has a degree in law and a master's degree in international development with a specialization in feminist studies. She has been working for the past 17 years with international NGOs, the Spanish Development Agency and the UN in different conflict-affected areas, such as the Democratic Republic of Congo, Rwanda, Palestine, Central America, the Sahel region, etc. Currently, she's an international consultant working on human mobility and committed with the elimination of any type of discrimination against women and girls, the empowerment of women, and the achievement of equality. She's a feminist and an activist. Welcome, Elisa. Majda Al-Sakka is a founding member of CFTA, the Culture for Free Thought Association. It's a national NGO which seeks the empowerment of women, youth, and children in the south of Gaza Strip. CFTA promotes the active engagement of women and youth in their communities and the achievement of their individual and collective rights. Majda holds a master's degree in anthropology from the University of London, the Schools of African and Oriental Studies, and she has been working for CFTA for over 30 years now. Welcome, Majda. Chikumbutso Ngozi is a women's rights specialist for ActionAid Malawi. She's a member of the Gender Consortium Against Gender-Based Violence. She has more than 12 years of professional experience in women's protection in humanitarian and emergency settings. She has a BA on human education focusing on human ecology, and currently she's pursuing a master's degree in humanitarian protection work with Kalo Institute. Welcome, Chikumbutso. So let us start the discussion. Can you please describe the emergency protection concerns you have identified associated to the COVID-19 pandemic in your work? How did you mitigate these risks, and how did you protect the people that you are working with? Was it easy to protect them? Did you have enough capacities, resources, and support to respond to this new situation and to conduct your work? Who would like to start? Chikumbutso? Would you like to start?
I can start if it's okay with everybody.
Thank you, Majda. Yes, please.
Yeah, just a technical thing. I will just switch the camera off because the line is very weak in Gaza, the internet line. That's all.
Sure, no problem.
I just want to, first of all, thank you all for coming to this meeting, and I'm glad to meet with colleagues from all over the world, and I'm looking forward for this session. I just want to say that when the pandemic came to Gaza and Palestine, it came to add to a situation which already was a humanitarian situation because of the blockade, because of the occupation, and because of the deteriorated humanitarian situation over the past 2 decades. I'm sure the majority of you know that Gaza in the last 10 years had 3 different wars or attacks from the Israelis. The pandemic came and entered into Gaza, or started, the emergency started in Gaza in March. For us in the beginning, it was like something we were expecting to be in another way. We were expecting that it would be more of a political or a security or a war situation, that we used to deal with. But suddenly we are faced with a situation that is new, that is focused on health, that are impacting women, that are impacting every single person in the Gaza Strip. The health system in Gaza was already destroyed, and this pandemic came to add to it. What was very, very interesting is that the civil society, almost all NGOs in West Bank, Gaza, Jerusalem, they were kind of ready for an emergency, not for the pandemic in specific, but the readiness we saw was amazing, because everybody moved, for example, to connecting with the people, especially women, because they are most vulnerable groups, at least in our community, because we are living in a patriarchal society. Now, we connected to them not from a health perspective, but from a prevention and protection perspective. And that was really difficult, because when you're talking about poor people and you're talking about lockdown and cutting between governorates and cities, you are talking about access to these women and these vulnerable groups. So alternatives of tools and methods be available. And I think it's amazing that the people who led all these responses from the beginning were women NGOs and women movements.
Thank you so much, Mazda. Elisa, would you like to continue?
Oh, Chikumbutsu, if you want to go ahead, please.
Okay.
Okay. For Malawi, and the situation has not been so different. Number one, I think to start with is to say that COVID-19 found Malawi when many communities were already experiencing different disasters. To start with, there was Cyclone Idai, and then there was a hunger situation, and then we had floods, and then we had drought. So by the time COVID-19 came, it was a situation, it found us when we were already in a humanitarian situation. So what COVID-19 did was to increase the burden and the vulnerability of women to different protection issues. And mostly, it was the issue of gender-based violence. And we saw that because of this, there were different disasters that the young women experienced. Number one, it was the spike in the cases of child marriages and early pregnancies. Just in 2020, 140 children were affected and had early pregnancies. And we had 140,000 actually children were victims of early marriages. And we had 43,000 cases of early pregnancies by children of ages between 10 to 19. Beyond that, we also had serious challenges in terms of response and response of gender-based violence, mainly because of limitations in movement. So women were locked up in houses, or they could not access the services to gender-based violence very well and timely. Number three, it was disruptions on and limitations in terms of livelihood options for women. So we had women who were depending on a number of informal works, or working on setups where their livelihood options were weak. We had women who are working currently, even up to now, working in informal work setups where labor laws are very weak, they are exposed to sexual gender-based violence, they can't report in time because it's just informal contract. And in that informal contract, because the livelihood options they were depending on have been disrupted by COVID-19. So I think to sum it up all is to say that COVID-19 has had a serious impact in Malawi, especially when it comes to protection work, from starting with destabilizing the prevention work on gender-based violence, and even when it comes to response or mitigation of gender-based violence. Now, in terms of what strategies we have been able to implement to ensure that we reduce the risks, number one is to ensure that we promote empowerment of women. So we have really promoted empowerment of women in whatever setup we have been working in just making sure that women are able to speak and to challenge gender-based violence. Number two is to ensure that we strengthen reporting mechanisms. We know COVID-19 is not easy, but we have tried to use whatever remote system we can in terms of promoting reporting and uptake of cases on gender-based violence. We have also tried to support, to strengthen livelihood options for women. Like for instance, we have conducted programs where we have distributed food items to women or strengthen their economic activities, just to make sure that that also acts as a risk mitigation factor. So for now, I think this is what we are doing in Malawi in making sure that we are strengthening protection work in the context of COVID-19.
Thank you, Chikumbutsu. Thank you very much. Elisa,
Okay, Eva. Yes, thank you. So, I mean, I wouldn't add more than what my colleague have said. Maybe just say that, and this is not my words, but to say that COVID-19 has been the perfect storm. So whenever there was a humanitarian crisis, a humanitarian situation, what COVID-19 has done is to increase the needs and affect the most vulnerable. And that we can see it in Malawi, we can see it in Gaza, we can see it in Venezuela crisis, in the Sahel region. So maybe just to share with our audience today that yesterday there was a publication that I really recommend from Amnesty International, and in which they, among other information, they were saying that COVID-19 had really affected refugees, asylum seekers, and migrants. No, so maybe now that I'm working with within the human mobility issues, I maybe would share with you how, for example, certain measures that have been imposed by COVID-19 have affected, for example, migrant population. And I would put an example of the Venezuela population, but this would be the same, for example, in the Sahel region. No? So the closure of the borders has impacted and has increased the protection concerns regarding people blocked at the borders, increasing food security, increasing sexual gender-based violence, affecting human rights of this specific population. No, so I would want to raise this here with you today. How did we mitigate, or what I can share with you, and what are the mitigations that I have seen being implemented by for example, the international NGOs. So it's nothing new, you know. So the thing was to see what were the needs, and try to respond in the better way possible. As I said, food insecurity, of course, water and sanitation needs increase exponentially for this population. Access to sexual and reproductive health was something very, very serious to take into consideration. And why, for example, to give an example of this, no, how these people that in most of the cases do not count with the needed paper to access to the health systems, have been completely blocked because of the COVID-19 situation. And this is something that we need to take into consideration. Was it easy? Eva was asking. I think this is never easy, no? The answer would be, it's not easy, but I don't see that we have reacted better or worse than we normally do. But we have put in practice certain things that we have been learning from other emergencies, no? So that would be my answer to this question.
Thank you so much. Thank you. I think that you are raising up very important issues. For example, how the impositions on mobility restrictions have brought women being in the same home or in the apartment locked in with the perpetrator of gender-based violence in many situations, with extra added challenges to accessing protection services, or as you were mentioning, Elisa, sexual and reproductive health services, or multi-sectorial services for the survivors. Would you like Mazda or Chikungut to provide more specific details on how did you overcome this situation where the teams, because from our experience, the teams were also locked in their houses, providing multi-sectorial and support to the GBV survivors at the homes. And we were facing like very difficult and challenging situations where, you know, both from for the professional and the survivors to address the situation where they couldn't meet. There was really an emergency. GBV was really increasing, and it was a very big challenge, no, to provide safely these services. Would you like to give us more details on that?
Yeah. Yes. You know, when the corona spread in the society in Gaza, and we had the lockdown, and here we don't call it a lockdown. It's a curfew that is imposed by the authorities. So it's imposed by power. So the problem is that we couldn't access to our centers. The women could not access to the safe spaces. We received lots of calls for help, and it was very difficult for us at so many different levels, because also our team was infected. But what happened is that, you know, together, because we have a participatory approach, together with the women we have been working with before, we started to develop alternative ways of working. Internet and electricity are very difficult in Gaza, so we quickly tried to find batteries for the women. We provided them with internet cards. We provided them with tools to communicate, to ask for help, especially the women whom we know that they are at risk. The emergency started in March, 7th of March, I think. By April and May, all the women we knew, especially the women who are at the areas that are access restricted areas, they were provided with tools of communication depending on their situation. Some of them it was batteries, some of them we provided them with wires and connections for mobiles. This is one thing at the practical level. The second thing is that quickly we contacted the women police in Gaza, and we requested from them that we train all the services providers, especially those who are affiliated or working for the government, because all of them were men and all of them are not sensitized to work with women. We had the public quarantines where women were locked in schools, for example, and all the services providers, the psychologists, the social worker, they were only policemen. And they are not used, because we are in a conservative society that separate men from women. They actually didn't know. And sometimes even for women to ask for specific small things, like even diapers for their children, they were shy to ask the policeman, or they were even scared to talk to them. So what we did is that from the month we trained 240 police men who are working at the quarantines. We developed a guideline for referrals for the services from the quarantines online, and when they are released, we provide a program for the go back to the house for the women, because there are also stigma on corona. So there are lots of work that was done. It was not easy. what was really good about our work, and we think we somehow succeeded and we responded quickly because it was in participatory and because we were in daily connection with the people.
Thank you, Mazda.
And maybe I can also come in to share experiences from Malawi. So the COVID-19 situation, one thing that it made it so visible was the important role of women in protection and important role of women in protection work. And we seriously learned that nothing can beat human interaction. Yes, we can have the remote support through phones, but access to phones in Malawi is kind of limited. And not just that access to phones is limited, but when someone is in a crisis and is experiencing gender-based violence, most women prefer a human face and a one-to-one discussion. So because we had a preparedness plans for protection, where we had community women-led organizations and structures that are led and have clear referral pathways for gender-based violence. We noted that most women who experience, girls who are experiencing gender-based violence in the context of COVID, they had options from the women in the community to say, okay, we have this person who is a paralegal in our community. So they'll quickly get a way in which they can get in touch with that person and use other referral mechanisms to access probably justice or to access support immediately. This would not be possible if we had no preparedness plan on the community when it comes to humanitarian situation. So what COVID-19 told us that it came as a disaster, but because we had talked about preparedness, emergency preparedness, but from protection perspective, and we have community-led organizations that are in place to talk about this, this has really helped women in the community. Of course, it has its own challenges. Number one is to do with backlash from the men in the community to say, how do women come in and provide work in a space, in a domain that has been mostly dominated by women? That is still a challenge, but still the women have been empowered and they are well trusted in the community to tackle issues of gender-based violence and to engage in one-to-one discussions with most women. So for us, I think that has been very important. Another challenge, I think, has been resource constraints. We have women, we have structures, but I think access to resources is still a challenge. In most communities, protection preparedness plans are trivialized. And this is much more visible even in the budget for disaster response that is in most communities. So that one remains a challenge, and I think this is an area that needs proper improvement, because when it comes to access, we can have plans, but they cannot be implemented if we don't have resources.
Thank you so much. I can see there are two questions. No, this is an introduction. There is a question here in the chat. I think any donor international NGO to work in Pakistan, please. This is a request. Okay, no. I thought it was a question. Thank you so much. Is there any relevant question from the audience? Someone would like to make a question regarding this specific topic that we were discussing? So if no, then I will jump to the next question that are more specifically regarding the strategies, specific examples and strategies that you've been using to increase women's role in the response during an emergency. So is there any specific gap you identified? Chikumbutsu was mentioning now about the budget, for example, and a specific challenge in the response to these emergencies. But regarding now specifically the engagement of women in the response, how do we think that we can promote the engagement of women in this humanitarian action response in case of COVID-19 or any other emergency that we can prepare for in the future?
Maybe I could step in here, Eva, just to share with my colleagues and with the audience that I really think that women, as in most of the emergencies, seem to have been the first responded in the COVID-19 situation, and there usually are in a humanitarian crisis. So this has been again a way of showing that that we need to step in women's participation. Women are always there, responding externally and internally. There is if I can underline a gap that maybe I could identify in this response, would be again how much we have asked women to be in the front line, no? For example, just giving again an example of a specific case. So because of the closure, because of the restriction of mobility, schools were closed. So kids were meant to be working at home, and we were asking those women to be in the houses, but also responding to the emergency. Of course, unpaid care work has been rising, and this is an issue that we from a feminist perspective, we do not have still the answer there. We have been asking, for example, those teachers which in the most of the places where we are intervening, these teachers are women, so we have been asking them to increase knowledge on how to work in another way, providing capacity building, again requesting them to be, as I told you before, in the front line, without maybe taking into consideration the other charges that they had because of the COVID-19. So maybe I can put that on the table for my colleagues to contribute to that.
May I say something? You know, I want to look at this question in a more of a critical way. With the pandemic situation, and before that with the war and with the blockade and with everything, we witnessed and we see that the majority of the frontline defenders, they are women, and they are always, being forward, whether they are nurses, doctors, teachers, mothers, NGOs workers, and they are doing a great job actually. We in the pandemic, to be very specific, we were very close to the community and to the people, and we addressed the needs. We prioritized.
Marcia, I'm afraid we are losing you.
Sorry. So we prioritized interventions, we strategized, we prepared emergency plans, and we put it on the table for the leaders who were men at the end of the day. In Gaza, we were not allowed as women, whether NGOs, even like nobody was allowed but certain men to be in the Central Emergency Committee of COVID in Gaza. Okay. Even in Gaza, even in West Bank, I think in West Bank there was one woman because she's the Minister of Health, with this current situation. And it wasn't like something that is like it's a right for women to be there. It was by chance. The men who were leading the emergency committee, they were taking, all the strategies, and they were taking all the services that we are providing and all the work which we are providing, but we didn't manage until now, until this moment, we did not manage to be in the leadership of the emergency committee. And here I want to say that we should be very careful that we are working 24 hours, we are contributing, we are doing lots of things, and we are improving the situation. We trained even the men to do a better job. But at the end of the day, we are not at the decision-making level. We are not, we are trying to be influential. We are fighting for it. We are not passive. But we are still very far away from being at the decision-making level. And the election is coming now, for example, in Palestine, and it's a quota for women. It's not about the quality of women participation. This is what I'm trying to say. And this is something very important. I don't know how it is in the other parts of the world, but this is, for me, this is a major issue. And as much as women are giving and they are dying and they are succeeding and they are achieving and they are doing their best, and they are doing double and triple jobs because there is no work division in an equity way. But at the end of the day, there is this kind of no justice, and we need to look at it, at least in Gaza. I don't know what about the other places in the world.
Thank you, Mazda. Very important points about decision-making spaces. Shikumbutsu, you want to add?
Yes, and I think in Malawi, the situation is a bit different because Malawi is a developing country, and promoting women's law in emergency has been a long-term struggle. And what COVID-19 emergency situation has done is to show us the fruits of the role that we have been playing in facilitating women's leadership and women's law. So very quickly, what we did in around 2006 was to promote women-led organizations. These are called community and localized feminist-led women groups. These are at grassroots level. It's a nationwide movement from the grassroots level to national level. So using that existing platform, what we have done in each community is to push for participation of women in these spaces. And we've noted that it's through women forums that, because they are trusted women-led institutions, it has been very easy now for them to be part and parcel of the broader committee when it comes to emergency and protection issues. And it is these groups that have pushed for issues of protection to be prioritized. Because like I said, in most communities, without participation of women groups in these organizations, number one, women's rights and protection issues were being trivialized by civil protection committees from grassroots level. Number two, it was the same civil protection committee members that were abusing women because they want to provide a service. So in making sure that women-led organizations have the right capacity in terms of having a critical thinking and the feminist-led analysis to understand the structural causes of disempowerment or unequal power relations between men and women. This is what these women have been doing. So these women have been able to do this because we've been investing enough in this this process, the process of mobilization, the mobilization of women in movement building of women groups, the process of empowerment of women individually and as a group. So what COVID-19 probably has provided is to show us the results of supporting women-led organizations before maybe another deep and a bigger emergency situation comes in.
Thank you so much. Is there any other question, any comments that from the audience we should consider before we go into the next question? I don't see anything in the chat. So then I will be asking you another question. What do you think, from your experience, from what you saw in this humanitarian response, what do you think are the benefits of women leading the emergency response? What were the positive outcomes or the impact that you see when women are involved in a humanitarian response, when women are responding to an emergency crisis? Can we talk about the effectiveness of the response in itself? Can we speak about the benefits on the women themselves also? Can you give us examples on very specific examples or something that really called your attention when you realized, wow, involving women on the humanitarian response is really bringing benefit on it?
Maybe I can start from Malawi. All right. Okay, I can come in.
Yes, please, Chikumbutsu, go ahead, please.
Okay. All right. For me, the main benefit has been in influencing power shift in the communities. So in promoting women's leadership or women's participation in response or prevention of the emergency, it has been sending an indirect message to the community and in a way challenging the existing social inequalities. I'll give an example in a community where they look at women as recipients, as a group that always has to be at the receiving end. But the moment they have seen women leading and taking action, it has in a way challenged the mindset of many people in the community to say, oh, even this woman, especially when you put women who are experiencing multiple vulnerabilities, probably they are living with disabilities, or maybe they are excluded in a way or the other in that community. The moment you put them in the forefront, it's a process of empowerment, it's a process of challenging the social existing inequalities. Number two, so in a way, it's more of a power shift strategy. Number two, I think it has increased uptake of the services, especially the gender-based violence services. So if women see that this group of women, they've been supported or they're doing ABCD, it makes other women to open up. How can I open to a man when it's hard to open up to some issues, especially to a man, unlike to a fellow woman. So it provides an opportunity for increasing uptake of cases. But most importantly, it's about ownership. Most women are the ones who are impacted more by emergency situation. The moment there is a response that they are involved in, they get that and they hold it very tight and they land with that agenda. So that ownership, it pushes them, it even call for accountability from government. For instance, when it comes to protection standards, protection work, it has standards. But because women, they own that, they feel that it's part of them and they act with passion in whatever work they are doing. So for me, I think it's very important to indeed involve women, and the benefits are more, but I think at this point in time, I can ask my colleagues to also add in experiences from other countries.
Thanks so much, Chikumbutsu. Majda, you want to continue?
Yeah, I want to say two things actually. One, which is straightforward, that the responses, when it came from women, and this is from the experience, and I'm talking about the huge emergency experiences in Gaza that we went through. The responses this time with COVID was mainly led, especially the ones on the ground, they were mainly led by women, and it was very sensitive to everybody. Sensitive to children, to women, to girls, to older people, to persons with disabilities. This we didn't see before. So this gives us the sense that really when women, and I'm not being pious here, but when women look at things, they look in a more collective way, in a more just way, in an equity, not looking from a narrow perspective. This is very important. And I think if there is an impact study, it will show us, or comparative study, sorry, between what was before and how it developed now. We will see clear things that women did that was not happening before. I'll give a small example of how women, whom people call vulnerable women, for me, they are empowered women. You know, everybody knows that the economic situation all over the world is collapsing, including small businesses. And women in Gaza, there are lots of small businesses that are running. And the small businesses were affected directly. And we are talking about businesses that $2,000 in all, you know. When the emergency happened and the lockdown happened, and you know, these women were working because they were supporting other women who were working. Like, for example, they were producing things for teachers, women teachers, or for women nurses, cooking for them, or something like this. When the pandemic happened and the lockdown happened, they went back to zero. The income was zero. We had a small WhatsApp group for women, and they started, you know, brainstorming, and they came up with the huge ideas, you know, and creative ideas and solutions. And we could see that over the past 9 months, the only businesses that are running in Gaza are the women-led businesses. This for me is amazing. The woman who was like preparing the vegetables or the ingredients of a meal for another woman who is working as a teacher, and she's taking money out of it, and she stopped working this work. The other women gave her an idea to do these things, but to package it better and give it to the big mall, so the mall could sell it for her. So she started to make more money, you know. These ideas, they were coming in a group discussion over WhatsApp and things like that. I know that this is a very small example, but it is an inspiring thing. And it wasn't one or two. We are talking about almost 37 projects that are not dying with the pandemic, while the big businesses are dying, while everybody in the world are affected. So I'm very proud of what women in Gaza did, and I'm sure there are lots of beautiful examples all over the world. But I talk about Gaza because Gaza has, like, I need to remind you that 80% of the people in Gaza depend on external aid. The unemployment rate young people, who are almost 70% of the population, is almost 70%. You know, in this kind of situation, which is like everybody is depending on a humanitarian assistance, people are trying to pull themselves and to pull their inner resources and do something to be liberated from the external funding and external, you know, humanitarian, control. Now, our problem is we are not a natural disaster. We are a political, man-made disaster. It's an occupation and blockade. And this is why we cannot talk about big development. But I can see, you know, there is a big hope that women are planting, and we are going to harvest very soon if we continue to progress in these areas.
Maybe if I could add an experience. So what I maybe would underline from this emergency compared to others, for me, it's the how women have been also leading within the UN system, within the international organizations, within the development agencies. Women have been positioned as humanitarian responders as never seen before. And I think that because as the audience, I suppose, know, and we have, I mean, for those who work in humanitarian action, mostly humanitarian action is a male-oriented job. So you will find always more men responding in a humanitarian crisis, natural disasters, or man-made whatsoever, than women. But in this case, what I have seen is that more women have been there, have been in the coordination systems, have been in the clusters, have been responding to those emergencies. And of course, that has had a direct impact in what was the prioritization of the response in this emergency. And I'm talking about an increase on mental health services, an increase, for example, on menstrual hygiene, specific projects, distribution of dignity kits directly focused on women, girls and adolescents, this type of things that I really believe is because these women were at the front line in the response that have been highlighted, and then money was reverted to be able to distribute this type of items. No, so I would, from my side, I wanted to put that on the table too. Thank you.
Thank you so much, Elisa. Any question from the audience? Any comment? Anything to add from the audience? Well, if not, I'm going to ask you the fourth question of this session. What do you think is important for us as international community, let's say international organizations, the UN system, donors, to learn and to understand better to ensure a more effective and localized and more feminist humanitarian action? What would be the key messages that you would throw to us as an international community to learn and to take into consideration for the humanitarian response?
Which is a very, very complicated question. So I don't know if my colleagues want to react like that, or maybe we can just open a debate, because I don't really think I have an answer for that. I mean, I really think this is a key question, but I'm not sure I would have the answer. No, I think as international community, and for the ones that we have been working in international NGOs for a long time, I think we still need to work more. I mean, to position beneficiaries at the center of the response. No, I still feel that when there's a humanitarian crisis, most of the response are decided in a table in the city centers, or by donors, external donors, or whatsoever. And I still think that the responses would be more effective if we provide grassrooted responses. But I would leave also the space for Chikumbuso and Aida to answer to that.
If I may say something, or a few things actually here. The first thing is that, it's related, of course, to Palestine. One more time, I cannot take, any context in Gaza, West Bank, Jerusalem, without, it's being connected to the occupation. And I see that the major role for international community is advocacy, accountability, and bringing just peace for the Palestinian people. This is the first thing. And in fact, our existence in Palestine as NGOs is because of social justice issues. This is one thing. The other thing is that, I would recommend, especially for UN agencies, to be more, it's not, the word is not flexible, but something like flexible, because flexibility can be dangerous sometimes, but something like flexible, or to liberate them from the look frames, result frameworks, and checklists that they are making, and try to examine accountability and transparency in a different way, to hear the people, to put the community in the center of the action, not by only doing field rapid need assessment and these kind of things, which are it looks professional at the papers level, but when it comes to the community, to bring a consultants and spend 2 weeks with women or men or whoever and say this is the most prioritized need, this is ridiculous. This is ridiculous. We should look at things in a different way. Plus documentation, when they are asking for documentations, it should not be the what's the word? It should not be for, and I don't want to attack anybody, but it should not be for a checklist. It should have a soul. Sometimes they are with their systems and checklists, they are pushing people to be corrupt, and they have to be very careful about this. They should go to the people and ask them. They should be creative. They should go out of the look frame. They should give more flexibility, especially during emergencies. If I say I don't want to do a training and I want to buy diapers, they should buy diapers because this is what people want. So these kind of things. They should not strategize in the offices and say we did it in a participatory approach because they did a consultation meeting with 2 or 3 people who are working for NGOs or working for companies or whatever. This is not participatory. So they should go back and ask themselves what we are doing, and they should ask us also on the other side of the story what we are seeing, because we are with the people and we are the people. This is very, very important things.
Thank you so much, Mazda. Shikumbutsu, would you like to add, please?
I think one thing that has been highlighted, and I think it also applies to the Malawian context, is an issue of accountability. Accountability by INGOs, UN agencies, or donor communities, and accountability in terms of how the intervention is formulated. So what we have noted is that in coming up with a more localized and a feminist humanitarian program, it requires flexibility on the side of the donors and a flexibility on the side of government. Because I'll give an example of communities where we are working. If we are truly embracing the participatory women-led approach, what it means is that we need to give women the opportunity to make decisions on what approaches can work on their context. And in most of times, if you're not careful, you see a situation where they are being disempowered. So it's a political decision, and I think it's an issue of legality, and it's an issue that also speaks to the core humanitarian standards when it comes to humanitarian work. And I think this has been a challenge in most contexts, considering that resources are a challenge, and they also depend on the external support. Now, balancing this, in other words, I think it's an issue of addressing power, unequal power relations between South versus Northern countries. To be honest, I think that's an issue for me that has to be seriously addressed.
Thank you so much. It's indeed a very difficult debate, and it's very complex, no, to see how to respond to the humanitarian needs in such a corrupted sometimes system as the humanitarian response, globally speaking, it is, no, or the whole system in the way that is synced, and as you are saying, with a very clear power relationship between North and South, and all these dynamics. Is anyone from the public, from the audience, who would like to contribute? No, or any other panelists that would like to respond to any other? If not, I'm going to ask you about the last question of today's session. Yes.
Eva, if I may say something, a very important point also, which I forgot to speak about the role from INGOs and UN, EU big agencies, is that, when it comes to humanitarian support, they always need to remember that the target are the people on the ground, the people who are affected. Normally, the people who are affected are the first responders, while UN and other big agencies are bringing expats and people from outside and considering them as responders. And in fact, they are not. So things should be local, and this should be our advocacy as well. But if this meeting is bringing recommendation, I would like to put this as a recommendation. They need to examine what they are doing. Taking an aeroplane from, I don't know, a rich country to a poor country and distributing food baskets for people is not a response. This is increasing the misery of the people. Okay, we need to look at things in a different way. The people who are affected are the resources, are the responders, and we need to empower them. This is how they should look at things. We should not look at agencies that are taking 45 to 65 overhead cost for a humanitarian project and giving I don't know what, or even 50% of the resources to the people. And in the case of Palestine, and I will keep saying Palestine because Palestine is my country and my beloved country. In Palestine, unfortunately, the humanitarian aid is about paying the taxes for the occupation instead of the occupation. Paying for what the responsibility of the occupation should be the international community are doing. Gaza, West Bank, and Jerusalem are occupied by the Israelis, and Israelis, according to international law, should look after the people they are occupying, okay, until we are liberated. What happens is that the Israeli is not taking this role, and the international community comes, or the international agencies, they come, and they are doing the job of the occupation. This is very bad. They are adding to our misery.
Thank you, Mazda.
If I may add to what Magda said, of course, I think that in every crisis, as far as I know, we have criticized the funding model in humanitarian action, and this is what Magda also was raising. It's clear that the funding model does not work, that it perpetuates the different and the power relations between ones and the other, and is at the end, sometimes in the case of Gaza, is not contributing to anything. At the end, when you cannot give humanitarian aid when it's a crisis related to human rights. So just wanted to contribute with to Magda like that, and maybe as a positive, and this is something I suppose we're gonna see in the coming years. Things. I think this response and because of what Magda was saying, expatriates, we were not able to respond in the emergencies. We were also blocked. Closures were there for us, and at the end, the response was there without us. We have also contributed to decrease the climate impact of humanitarian aid. We have launched different ways of working that before we didn't even think about doing. And I think that is a positive thing that we will need to analyze in the coming years, and I think it's going to change the way we do things. I'm pretty sure about that.
Thank you, Elisa. Chikumbutsu, would you like to add something?
No, not at the moment.
Okay, very good. Thank you. sorry, let me make the last question to you. At the beginning, we were speaking about feminist leadership. What do you think that is the difference between feminist leadership and women-led leadership or humanitarian response? Do you think it's possible in your context to shift, to change from a women-led perspective to a feminist response? Do you think this is coming in the near future? Do you think it's possible? Do you foresee any challenge or resistances according to this?
Maybe I can start by sharing experiences from Malawi. So like I said, we started with building the movements, and that was basically a women-led humanitarian response. And what we noted was that the moment we shifted from women-led humanitarian response to feminist humanitarian response, we noted that the impact was much more better. In the women, it's the transformative feminist humanitarian response that has built critical analysis on women to begin to question the issues of inequalities on power. Because I think the feminist lens in humanitarian work, it has really empowered women to begin to question the issues of power imbalance, the issues of inequalities. So the feminist leadership approach in humanitarian work has helped us to really promote the effectiveness of women leadership in humanitarian context. So for us, I think when we talk of when we talk of the leadership we want, in the type of leadership we want in the humanitarian response, we say it's a type of leadership, number one, that can question the very issues of existing inequalities. And most importantly, to also add the other facets that exacerbate exclusion. In other words, I think it's a question of now transformative kind of leadership, because it is through transformative leadership that we have identified that the group of women or the category of women cannot be treated as homogeneous. Within the category of women, there are women who are excluded because of their race, because of their sexual orientation, because of whatever it is. So it has helped us to be open-minded, to be more acceptable, to even avoid excluding other women as women leaders. So for me, if someone asks me which one is much more better, I think transformative feminist leadership, actually intersectional feminist leadership, is much more appropriate, and it helps us as women leaders in emergency situation to address the different facets of exclusion and to question the issues of inequalities and the existing power imbalances.
Thank you so much, Ikumbutsu. Mazda, would you like to continue?
This issue between women-led and feminism, again in Palestine, it's a totally different issue, because vulnerability and social justice is not achieved by people. People, feminism, women, youth activists, everybody. So a few years ago, we used to say that it has to be feminism, and it has to be this activism, and it should be women leaders, because we don't want to exclude anyone. But unfortunately, because of the unhealthy situation of the donors who are engaged with Palestine, there is an exclusion of so many people now. With all these women responses, there are exclusion of youth, there are exclusion of persons with disabilities, there are exclusion of women and men, and so it's a big chaos, and strange. There is, the bottom line is that there is no social justice. When there is no social justice, it's not for anybody. There is no social justice for anybody. Women are, of course, most affected, and activism should activism of women are, proven to be really strong and effective. But it's the situation here is that the deteriorated humanitarian situation made every single person in occupied Palestine, or 80% of the people, as people at risk and vulnerable, and this is why there is a big debate. Everybody is talking about this, and there is, like, for me, I cannot give a clear answer. For me, I want to do social justice for all, women, men, every single person, every human being, Palestinian and non-Palestinian as well. I don't know. This is very difficult for me, actually, and I don't want to just say things that are in books or in theories. The situation is, there is no social justice, and for me, any movement that I'm involved in, at least, is about social justice. So it should be beyond women-led and feminist-led. In summary, it should be human-led. I don't know if I was clear or not.
Yeah, from my point of view, feminist leadership is not against the inclusion of any other people. So, in my point of view, it's quite the opposite. But I would like to hear, Elisa, also, if you want any comment, or if you would like to add.
Yeah, thank you, Eva. In fact, I was going to react a little bit to what Magda just said. I really think, I mean, the patriarchal structure, and the society is also embedded in the humanitarian structure, and patriarchal system is there. And to answer to the question, if it's possible to change from woman-led to feminist humanitarian response, I think it is possible, but still very difficult. We need more feminists in decision-making positions. And this is because I think feminist response would, from a critical perspective, will try to break down the status quo, and I think that status quo that is in the society and is also in the humanitarian response needs to be challenged, and that is not going to be challenged by anyone on any other structure or any other movement that is not the feminist movement. Of course, this is a personal opinion, but yeah, again, I leave that on the table.
Thank you. Well, thank you to all of you. I think we wanted to leave the floor for our participants to pose their questions, to make comments, to add anything they would like. And I would really like to hear from the audience also. So please feel free to write your questions on the chat box, or to just unmute yourself.
Yes, and please don't be shy, because for us it's very difficult. I mean, also this new way of doing things through the internet and by webinar give us the opportunity to be together from long distances, but also it has this barrier of technology, which is not always easy to break down. So please help us on that.
Thank you. You're right. I'm not sure if it's only the three of us here, or if there is someone else
no,
on the other side.
There are 25 participants there, so yeah, we're happy to hear from you.
Maybe if someone from the participants who's working in the field of humanitarian could give us, like, perspective of what they think of the questions that was raised, and if they have a different opinion or something like this.
Yeah, something to add, any question or any comment? No? Well, I think if there are no questions or comments, we can close. I was trying to summarize a little bit some of the conclusions that we had during this conversation. I'm sure I missed some of them, but I think we came together to the conclusion that COVID came as a need on top of many other humanitarian contexts and current needs and existing needs or situations, exacerbating the vulnerability of the most vulnerable people, no? Of those that were suffering the most. We also agreed that women, we see women as the first responders, and that we need to promote their participation more in the humanitarian response. We spoke about the importance of emergency plans and the create opportunities for those that are in the grassroots level to respond and to have the capacities, the skills, and the tools to respond. We spoke of the double burden of women when they are responding to this in these humanitarian situations, but we also pointed out how many times they are carrying these tasks, they are carrying this burden, but they are not in the decision-making spaces, and we point out also the importance of the advocacy for that, no, to make us participate women also in the decision-making spaces. We spoke a bit about the benefits of involving women in humanitarian action. We mentioned that this is a message to the community, and this is also challenging the patriarchal system and the gender division. And we also saw this as an opportunity for empowerment of women and to make them more active in their communities. We also spoke about the way that and about how this is making a response more accessible for other groups, either women that feel more free to access the response or the services or the support if there is other woman that is in front, but also how women think in a very comprehensive way, making it more inclusive for people with disability and for other vulnerable groups. As key messages for the international community, we spoke about the increase in accountability and transparency, about the importance of really promoting participation, real participation of affected population, and how to listen to their needs, and the importance of localizing the humanitarian action and responding using or seeing the affected population as really responders in the emergency, and not only as beneficiaries of the action. I'm sorry, because I'm sure I forgot many things because I couldn't listen and write at the same time. In case that you would like to point out any other conclusions, please do it now, and I will take notes. Otherwise, it is recorded and it will be also streamed in the social media.
Thank you, Ella. I think it was very, very nice resume of what we have been talking today. So nothing from my side.
Thank you. Thank you, Lisa.
Thank you so much. Thank you, Eva, for leading this session. Thank you. Thank you. Thanks for all the participants as well. Nice to meet you.
Shikumbutsu, would you like to say something, to say goodbye?
Thank you so much for this opportunity, and I really appreciate to share experiences from Malawi on how we are doing our protection work and to learn more through this engagement. Thank you.
Thank you so much. I would like to thank the three of you for your really super interesting inputs and for the food for thought that you gave us. And I hope that it was useful and interesting for the audience also. And I'm very happy to meet you all here. And I hope that there is more webinars coming in the next days. Please check in the chat box the social media of the IECA to see the program for the next sessions. Thank you so much, and thanks for your time and for your contributions.
Thank you so much. Have a nice day. Bye.
You too. Bye-bye.
Bye. Thanks. Bye.
Bye.